You think you're suffering from lateral epicondylitis or tennis elbow, that pain on the outside of the forearm right here. I'm going to show you some tests that you can do to try to determine if this is truly what you have going on or maybe something else. The first test is known as a Cozen's test. Now what you're going to do is you're going to bring your wrist back into extension just like this. You're going to bring it into extension and you're going to radially deviate. So I've kind of got my thumb coming towards me here and my wrist back. So I'm like this. And my wrist is going to be in that position. I'm going to have my elbow bent a little bit. I'm just resting here on the table. And then I'm going to take my other hand and push down onto my hand, the back of my hand. I'm trying to resist me pushing my hand down. I'm going to resist that. I'm going to hold that and see if that reproduces pain and symptoms out here on the outside of the elbow. And if it does, then that test is positive. The next test is known as the Mills test. And so what you're going to do is straighten out your elbow. You're going to bring your wrist down into flexion. I like to have the thumb come into the palm here and just kind of rotate outwards just a little bit, also known as pronation. So we're going to pronate, roll outwards, see if this reproduces your pain and symptoms out here. And if it does, then that test is positive. This is Maudslay's test, and so what you're going to do is rest your forearm on the table here. You're going to pull back just the middle finger, so you're going to pull the middle finger back. I'm going to take my other finger or several fingers and resist it. So I'm going to try to push that finger down. That finger I'm trying to pull back. If that reproduces your pain or symptoms out here, then the test is positive. This is the chairlift test. I'm going to show you this from in a seated position. I'm just going to grab a hold here of the end of the table. So I'm going to raise this up so you can see. So I'm grabbing the end of the table. You would go up to a chair, say maybe a chair in your house that has an armrest on it, or like a lobby or waiting room type chair. You can grab the side of that. You're going to squeeze here and try to raise it up. You're going to try to pick the chair up with your elbows straight. If that reproduces your pain on the outside of your elbow here, then that test is positive. The last test that we're going to do is the coffee cup test. I'm just grabbing a coffee cup in this position. Now, it doesn't have to be a coffee cup. It can be just a glass or anything where you're putting your hand around it in this position. If you go and grasp the cup and you have an increase in pain out here on the outside of the elbow, then that test would be positive. Now that we went through the various tests to try to determine if you do have lateral epicondylitis, epicondylalgia, which is pain on the outside of the elbow, a tendinopathy issue. So now that we went through that, we've determined that those tests are predominantly positive. What can you do about it as far as at home? So I'm going to show you some exercises and various techniques that you can do to try to resolve your symptoms and return normal functioning to your hand. First, we're going to perform wrist extension exercises using a small dumbbell. Now, I have this small bolster here, and you can use a towel at home and roll it up, or a washcloth, or just anything where you can just prop the forearm up in this position. So what I'm going to do is take the dumbbell. I'm going to bring my wrist back. You should feel this on the outside of the elbow. It's okay if you have pain with this. In fact, I don't expect you to be pain-free while you're going through this program. In most cases, people that have a tendinopathy or tendinitis do have pain while they're going through their therapy program. In fact, if you don't have pain, you probably are not loading the tendon enough. So we're just going through this nice and slow. There is some research that will say that going through eccentric movements are more beneficial. That's where you use your other hand to pull your wrist back. You're going to slowly hold that and then just lower it down. You get to the bottom, use your other hand to kind of pull that dumbbell back, and then slowly lower it down again. To me, it doesn't really matter. If it's too painful just to go through the movement on your own, you can use the other hand to bring that back and then slowly come down. And I perform somewhere between 2 to 3 sets of 10 to 12 repetitions of this exercise. Now we're going to perform wrist flexion. So I have my hand now palm side up. I just rolled over in this position, and I'm going to go into wrist curls or wrist flexion here. I'm just going to come up. You're going to feel this on the inside of the elbow. Now I know that the inside of the elbow here is not where the pain is. This is on the outside. But we want to strengthen the entire forearm area, elbow, wrist, and also a lot of people notice loss of grip strength with this. And so we just want to make sure that we're performing strengthening exercises on the entire area. So we're just going to go through this again, 2 to 3 sets of 10 to 12 repetitions. Now we're going to perform radial deviation. So I'm going to take the dumbbell just like this, and I'm going to pull it back just like this, kind of going like I'm hammering a nail. You're going to feel this on the outside of the forearm here. And I'd complete 2 to 3 sets of 10 to 12 repetitions. Again, it's important to remember that it's okay to have pain with this. As long as your pain calms down and doesn't stay at, say, an 8 or a 9 out of 10, it calms back down to kind of where you were at baseline when you started your exercises. That's perfectly normal. These are finger extensions using a finger extension band. So you're just going to pull this apart just like that. You're going to feel that all down the back side here, the back of the hand, the back of the forearm, and I complete 2 to 3 sets of 10 to 12 repetitions. There's a whole bunch of different places that you can get these. I'll put a link in the description for these. You can get them in sets where there's different levels of resistance, from easy to harder resistance. I really like those, and I think that's a hard exercise to replicate sometimes, although you can take just a rubber band, wrap it around the outside of the fingers and hand, or even one of the small exercise bands that you use for other parts of the body, wrap it around, and then work on it to try to get as close as you can to one of these. Now we're going to work on grip strengthening, and so this is a hand gripper here. You can get a whole bunch of these different places. I'll put a link in the description of this one. And so you just squeeze here, just like this. You're going to feel it on the inside of the elbow. I complete somewhere between 2 to 3 sets of 10 to 12 repetitions. This is instrument-assisted soft tissue mobilization, or using a scraping tool. You can get these a whole bunch of different places. You can pay a lot of money for them or just pay a little bit. I prefer to pay a little bit because you don't need something that's hundreds and hundreds or even thousands of dollars. And I'm just going to take this and go over the area where it's painful and irritated. I'm going to go kind of back and forth, all different directions. I'm not using lotion initially because I want to cause a little bit of a shearing effect, a little bit of light micro trauma to the area. Be careful because the radial nerve does sit in here. So if you're getting a lot of tingling sensation when you're doing this in the back of your hand and finger, just be cautious of that. You can use a little bit of lotion. In fact, I would initially start just no lotion going all around. Then you can put a little bit of a lotion or emollient on that and just kind of go over the whole area for maybe to try to help with a little cortical mapping. Plus it feels pretty good. There's a little pain relief for that, some decrease in pain sensation. I also like to take a tennis ball. You can take a tennis ball and just hold pressure on the area that hurts. That usually feels pretty good, kind of that hurt so good sensation. So I'm just taking the tennis ball, going over the areas that are painful, and I'm pressing in. I may work it back and forth a little bit, make circular patterns. You can even take this and put it against the wall. So I have the tennis ball here and I push against the wall with it. So you can do that to hold pressure, just to try to get some of the muscle tone to kind of decrease and desensitize the area. You can also use one of those tennis elbow straps that come around, and basically what those do is you put those below the spot. So if you hurt right out here and this is where the pain is, you're going to put that just below that. You strap that on. And you have to be cautious with that because sometimes you can irritate the radial nerve because of the nerve running through here. So you want to be careful not to get that too tight. If you don't have a brace, you can take some tape, or this is a Coflex or Coban, that sticks back to itself. And so I'm going to say the pain is right here. I'm going to go right below that, wrap this around, make a few wraps around my arm here, tighten it up, and then that creates kind of a false attachment point. So it takes some of the pressure off of the tendon right here and kind of focuses that more under the strap. So you can do that to get some temporary pain relief for that. Another thing that I like to do is take kinesiology tape. Now this isn't a cure-all or a fix, but a lot of times it will give some support, makes it feel a little bit better and a little more manageable throughout the day. So what you do is you take this and you cut a slit in the tape. So what I'm going to do is pull this apart, and I have this little slit in this, and the reason for that is so that it fits over my middle finger here. So I'm going to put it over my middle finger. Now you can put this on, it can be on the index finger, whatever, but we're going to put it over my middle finger and get it to stick here. It's like sticking back to itself. And then I'm going to pull the tape off, or the backing off of the tape, and I put that and I just run this down my arm. As far as like the position of your wrist, you can have it neutral, you can put it in a little extension, whatever feels the best to you. I'm just going to run this right up my forearm like this, rub it, get it to stick down really good. And so that will provide sometimes a little extra relief as far as running down through the tendons, the inflamed tendon area through here. So I do like to use kinesiology tape just as an adjunct to everything else that I'm doing. The last two things we're going to do is going to be a stretch, and so you're going to go into a wrist flexion position. So the wrist is bent down. You're going to take your other hand and push back. You're going to feel that stretch across here, that area that's inflamed and irritated. You can also apply a tractioning force, so go just below this bony spot right here, just below that, and pull straight out like I'm trying to pull my hand straight off. Pull straight out like that. At the same time, bend and stretch down. That may take a little pressure if you have some discomfort here in the wrist just by pushing that down, because that can be a little uncomfortable, get a little pinch there. So traction that and pull when you go down. And typically you hold those stretches for 10 to 30 seconds, repeat that several times, just kind of throughout the day. Our last movement is going to be a radial head mobilization. So what you're going to do is you're going to come right past the elbow right here. So in this area, just past the bend of the elbow, you're going to take your thumb and you're going to come around, take your thumb and press down right on, you'll feel that bone right there. That's the radius bone. So you're pushing down. If you can see that, you're pushing down there. I'm going to push straight down in that direction towards the table. Not really hard. I'm just pushing down for a little bit of radial head mobilization. So I can push down and hold that. I can oscillate that. I can go back and forth several times just pushing down. There's been some research that supports radial head mobilization can have an effect for tennis elbow or lateral epicondylitis pain. Thanks so much for watching. I hope this video helps to reduce your pain and sensitivity that you're having out here on the outside of the elbow, and then improve your strength and overall functional use of your upper extremity. Thanks so much.